This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by The Woman in You.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. Did you know that there's a safe and natural way to reduce labor time by nearly 25%? Today our guest is Dr. Jennifer Eames from Marion Family Chiropractic in Marion, Mass. Dr. Eames received her Doctor of Chiropractic degree from Sherman College in South Carolina and is a member of the International Chiropractic Pediatric Association and the Massachusetts Chiropractic Society. We'll be talking about the benefits of chiropractic care during pregnancy. Welcome, Dr. Eames.
Yeah, thank you for having me.
Let's just start out with what are some of the most common reasons women seek chiropractic care during pregnancy?
Well, women will seek chiropractic care sometimes on their own. You know, the shape of their body is changing, the shape of their spine is changing, weight is distributed differently. And so they'll start getting some symptoms that maybe they didn't have before they were pregnant or might have had, but now are getting worse. Mm-hmm. You know, the back pain that you might think of or just that kind of discomfort. So we're able to take care of that by getting their spine into a better position for them. But often we also do get referrals from other practitioners in the area, midwives or doctors, because a lot of women during pregnancy are specifically looking to be able to take care of themselves in a more natural way for their own health and the health of the baby. They don't want to be taking medications or doing anything that's more invasive. So they're looking for the most natural, safest options that they can for themselves, and chiropractic care is a great fit for that.
So are there any considerations for getting chiropractic care, any contraindications?
You know, there really aren't. Women, when they're pregnant, there are some physiological changes that happen, especially towards the end of pregnancy. Ligaments can become a bit looser, so that's something that we're trained to work with and to adapt to. So there's a lot of courses that we take in postgraduate training, specifically working with pregnant women and infants. And within those classes, you know, we learn a lot to be able to work with those folks. But there really isn't any contraindication to it. It's actually an excellent thing to do during pregnancy. I know we'll talk about that more coming up. You know, both for the health of the woman and the baby.
So just mentioning the baby, I've heard that chiropractic care can turn breech babies. How does that work?
You know, it's interesting actually. It's not the turning of a baby that you might think of, like the external versions that are generally fairly uncomfortable that happen sometimes. What we work with as chiropractors is often what will happen when a baby doesn't want to turn is there are ligaments that run from the low back to the uterus. And when the low back is out of alignment, it will pull on those ligaments, and then the uterus is torqued in such a way that the baby just doesn't have enough room to be able to move. So by getting the spine in alignment, and the adjustments are really gentle, and then working with the ligaments to get those a little bit looser and not so tight with the woman, the uterus will unwind, and then the baby's able to turn on its own. So it's really a very gentle approach. Usually we see women in about their 8th month, they start to be concerned if the baby isn't in the proper position. And it's important to have the baby in the proper position, obviously, for the birth. But even prior to the birth, you want the baby to be in the proper position to be born, because the longer that it takes to turn past the time that it should, that baby can have more hip problems or other things because it's just not in quite the right position that it's supposed to be in.
Right.
And because there isn't a whole lot of room at that point.
Yeah.
So the baby wants to be down in the position that it needs to be in, that'll be most comfortable for the baby also.
And so it's kind of a preventative option to take.
Yeah, absolutely.
Care.
And we have had women who have come in the office that, you know, they want to get under chiropractic care prior to realizing, you know, gosh, my baby hasn't turned, because they want to make sure that that isn't a problem going forward. But we do have women that are towards the end of their pregnancy. We have many, referrals, especially from midwives, that come in, and we're able to take care of them in the end and make sure the baby's in a good position for birth. I think research-wise, they found that using this particular technique called the Webster technique that we use, babies turn about 92% of the time. And a baby won't turn if it's dangerous for it to turn for whatever reason. If, you know, the cord is in the way of its neck or something like that, the baby won't turn in those, and those are the percentage that doesn't.
So that's also going to avoid back pain and discomfort for the mother, not only during pregnancy, but perhaps even during the birth?
Yeah, and one of the main things that happens, actually, I'll show you the spine. One of the main reasons that women tend to get, quote unquote, back labor is as the baby's trying to be born, it can get stuck on this part here that you can see sticks out. And when that happens, they get the back labor. If this is in proper alignment and we can get a little more space in there, then that baby is going to be able to be born more easily. The mother will have less pain and it'll be easier for the baby. And that's why the statistic you gave in the beginning that women who are under chiropractic care during pregnancy have on average 23% less labor time, that's for their first child. For their second child, it's actually a 46% less. So,
Wow.
Making sure that things are in alignment and they're moving properly, just those tiny millimeters makes a huge difference when that
Wow.
baby's being born.
Yeah, sign us up for that.
Yes, I've had a lot of women say they wish they knew when they were pregnant.
Yeah. So what benefits are there to the baby if the expectant mother receives chiropractic care during pregnancy?
Well, one of the big things is similar to what I just talked about, that to have the mother's pelvis and low back, especially in good alignment, then that's going to benefit the baby in terms of any movement that the baby needs to make to be most comfortable and move into the proper positions for itself and do whatever development that it does within the womb. Also, one thing with chiropractic care is we always think of the nerves coming out from the spine and they can create pain. And they certainly can do that. But the nerves from the spine are also going out and they're running all of our muscles and organs and other things like that. So to provide the right feedback, for the baby and the mother's own monitoring of the baby by our own bodies, that's necessary to have those clear pathways, and those get cleared out with chiropractic care when we do that. So it's important for that regulation of what's going on with the baby also.
So not only for the comfort of the baby and the structural positioning, but also for the nervous system to reach all the organs and
be able to help the development
Right.
and bring that pregnancy along the best that our body
Okay.
can in the most efficient way possible.
Is there any specific nutritional advice you'd like to add about
Yeah,
pregnancy?
there's
Because you work a lot with that in the office.
Yeah, absolutely. There's a number of things that I think are really interesting. One, we're recommending now that women take 2 supplements during pregnancy that we really should be taking all the time anyway, but certainly when we're pregnant. And one is a good probiotic. That's the good bacteria that lives inside our body. Part of that is because the good bacteria in our gut is so necessary for our immune system to be strong.
Right.
And back to talking about wanting to be healthy during a pregnancy and not having to worry about, do I need a medication because now I'm sick? If women have good probiotics in their body, they're much less likely to be sick and catch things like colds or flus or whatever through the winter. Another that's excellent is vitamin D. Vitamin D does similar things. We think of it for our bones, but vitamin D also has a huge role with keeping us healthy in terms of vitamin D allows our bodies to identify viruses as quickly as possible, and then our immune system can attack them before they get us sick. So those two, but also having high levels of omega-3 fatty acids is really important, especially towards the end of pregnancy. Women that you can supplement with cod liver oil, and women that do that, they've found that it helps the baby's brain and nervous system development. So even 4 or 5 years later when they test those now small children, they actually had higher IQs, which is really interesting, and it started from the mother having that, and when she's breastfeeding also, if she continues with that. Towards the end of a pregnancy, there's a specific fatty acid that's really good. It's called GLA, and it's in borage oil, and that helps actually to get the body ready for labor. A lot of women nowadays, we're low in our omega-3 fatty acids, in our essential fatty acids, because of the American diet, and we're having these labors that are delayed, and the baby's a week late, and then 2 weeks late, and we don't want that. Upping the levels of the GLA seems to start producing the progesterone that we need to go into labor. So that's a really important one towards the end of labor.
So basically, in addition to your general multi-prenatal,
yeah, absolutely, and of
doing
course, yes,
the probiotics and vitamin D to keep the immune system healthy and
Yep.
on top of its game.
Yes.
And then
yeah,
and also the fish oil.
yes.
Adding the fish oil.
And yes, and of course a prenatal vitamin. And the important piece of a prenatal vitamin is the folic acid, the B vitamins, because that allows the baby's again its spine and nervous system and brain to develop normally. So,
is there anything that you do to help with morning sickness?
actually, there's a few things that they're starting to learn. Morning sickness is a tough one, but one thing that they're finding is that simply if women eat small meals and start as soon as they wake up, and even if they just have some crackers on the bedside table and they have them as soon as they wake up, and then instead of having whole meals, eat about an hour and a half intervals during the day, small amounts of food. That keeps the blood sugar a little bit more steady, and then that's going to help out with the morning sickness. And they're doing some research right now, and it's not out yet, so we don't know how it worked, but I'll be curious, and it doesn't hurt to do anyway. But they're finding that women who have higher iodine levels, which you can get iodine from things like kelp, or you can supplement with it, seem to have less trouble with morning sickness. So the research is still out on that, but it's worth trying. It's good for you anyway.
I know that they use iodine, and there's still a lot of research to be done around it, but more holistic practitioners are at least doing iodine tests for breast health. So that would make me think that if it's going to affect the hormones and
and that may well be what the tie-in is that they're going to
pregnancy
find.
and thyroid and all that kind of stuff.
Yep.
Let's talk about labor. Any positions that are best for labor as far as the spine and the delivery and the to ease the mother?
This is actually interesting because in the United States, women tend to be lying on their back in that supine position for labor. And that's actually one of the most difficult positions to give birth in because it actually closes down the birth canal.
Yeah, you don't see that in other native cultures around the world at all.
And there's a reason for that because it's really difficult to have a baby that way. So, whatever position seems to work best for the mother, but lying on the back really is it's a really difficult position, to give birth in, which then gets into some of the things regarding interventions that people may have that are less natural during their birth. If someone has an epidural, they don't have much choice about position anymore. Right. So the more that you can keep that birth more natural, it's actually going to be easier to have the baby.
Is there something in the way that the spine and the sacrum and the pelvic bowl align that closes the pathway? Yeah,
it actually, when you're lying on your back and you're in that supine position, it actually does. It closes it right down. The sacrum will come up and it will close that pathway. And it's that much harder, especially for the baby's head, which is the first thing to come out, to get out through what is now a smaller opening simply because of position. So a woman who's in another position, whether she's squatting or even on her side, that's going to be much easier for the baby.
Or on her all fours, something like that.
Yeah, on all fours, absolutely, absolutely.
So what are the benefits of natural birth as opposed to a C-section? Is there anything parents can do to try to avoid a C-section? How do you feel about that?
There are a lot of things. C-sections they're a major surgery, and not everyone realizes that because it is such a common intervention nowadays. But it's major surgery for the mother, and they're finding, besides the possibilities of something happening to the baby during the C-section, they're finding that when babies are born through a C-section rather than through a natural birth, even things like their immune system are affected because when they come out that way, they have a different set of bacteria that is starting to populate their immune system and start to develop it. And the babies end up less healthy later on. So it's best to avoid C-sections whenever you can. There are some things that you can do. One thing, anybody should have a birth plan. Sit with your partner and with the practitioner and write down, here are my desires for how I would like this birth to be. I only want intervention, for example, if it is, life-threatening to the mother or the baby. So you're not in that situation where you're having the baby and it's a lot of work, as you know, and you're changing your mind about whether you want interventions or not. You're more likely statistically, if a birth is induced, to have a C-section. There was a study of about 7,800 women, and they were induced. They were low-risk pregnancies. They were induced, and they found that with the inductions, about 44% were induced. About 50% of those ended up becoming C-sections, which is a huge number.
Yeah, that is a lot.
Yeah, so that's another reason, back to the nutritional stuff that I talked about also, to do the things so that the labor isn't so delayed that you may have to induce it, and certainly, not inducing a labor by choice for convenience or whatever else. So, also they've shown over and over that having a midwife as your primary practitioner brings down the C-section rate also. So, and there are excellent groups of midwives in our area. And just an interesting fact for people that are in this area, they did a statistical analysis of all the hospitals in the state of Massachusetts. And, you know, we have excellent hospitals here. And the lowest C-section rate in the state is Toby Hospital in Wareham.
Yay!
So, yeah, so I just think that's really
excellent.
neat. And at Toby, they actually use a number of midwives and DOs for births.
Midwives and to the medical staff for wanting to do that.
They do an excellent
fabulous.
job there. So, so there are things that you can do and that you can look into that really can lessen those chances of having a C-section, because it is not as good for the mother or the baby, except obviously in emergencies when it's necessary.
Yeah. Now let's talk about after the baby is born. At what time should parents have an infant spine checked? And
we what we recommend for people is the birth process, even in an ideal situation, it's not that easy on the baby either. You know, trying to get the head out and the shoulders and all that the baby has to do to be born. And besides whatever position they may have been in, maybe not an ideal position when they were inside the mother. So we recommend having the baby's spines checked chiropractically as soon as the parents want to bring the baby in. So we've seen. We actually had one baby in our practice that on her way home from the hospital, the mom brought the baby in and then went home, and we were able to check, and that baby was fine. But it's a good thing to look at. They say that there's minor birth trauma, not the major birth trauma that we think of, but at least a minor trauma that may result in a baby with a tilted head or some other thing in about 40% of births.
Yeah, that's
so so it's worth taking a look and making sure that baby, they develop so fast when they're little, to make sure that baby has every chance to grow, to its
and so
best
what
potential.
kind of adjustments do you make so that it would, maybe ease some of the viewers' apprehensions about having chiropractic on a little baby?
Little.
Yeah.
Usually, when we check a baby's spine, it's very gentle what we do, and again, if you're looking for a chiropractor, you want one that does specifically work with children and infants and pregnant women, and a good organization where you can go online and check if someone is a member is the International Chiropractic Pediatric Association. Okay, so that's one way that you can check on the practitioner that you're going to. When we see infants, it's very gentle work. It's really figuring out what might be out of alignment and lining things up, and then you press them about as much as you would to test a tomato to see if it's ripe. It's very gentle, just guiding things into alignment for them, and it's really wonderful, what you see with the babies, that, they don't need other interventions, or they're just happy, or we have seen colic that goes away. They're just more comfortable babies.
So you've talked about how the baby can benefit from chiropractic care right after delivery, whenever the parents are ready to bring the child in. What about the mother after going through the labor and carrying the child for 9 months? How can the mother benefit?
Yeah, and that's another thing. It's really important for new moms to have their spines checked also. The birth process also, that's a lot on them and their structure. So some go through back labor, some have easier labors, but there's always something structurally that has changed with them going through a labor. And some women can have persistent problems. I've had women that have said I've had this problem ever since I had my third child, and that child's now in college. So it's great to have a woman's spine checked after. It's good to come in because we also like to, in that visit soon after the birth, be able to talk with some of the other knowledge we have on, nutritional advice or the importance of breastfeeding or any other questions that the mother may have that they want to bounce off us. It's a good time to.
So, with the woman carrying the extra weight during all that time, obviously it's going to affect the pelvic area and the lower back. But do you ever find people then have, knee problems or other, neck problems because of that?
They can, and with breastfeeding also between their shoulder blades, things can get pulled on a good bit in there. So there's a good bit that we end up looking at. We always look at someone's whole spine anytime they come in, because if anything's out of alignment, it's going to somehow affect that nervous system and how their body's working and how their health is.
And then what about exercises or anything to sort of get back in shape, or is there any way that you give advice that way, or even post-nutritional care?
Yeah.
You know, so that their breast milk is good.
Yep, and we do talk about that often with them. You know, again, things like I spoke earlier about the vitamin D and the cod liver oil. Those are both important to continue with the breastfeeding, you know, because that will, again, help the baby's development, and we can get into certain amounts and whatever. With breastfeeding women, they can have up to 5,000 units of vitamin D a day, and then usually about a teaspoon of cod liver oil, or about 2,000 to 3,000 milligrams is good if it's a good product. And actually, one thing, since we're talking about cod liver oil, one thing that's important to look at is you want to have a reputable source for that, because when someone's pregnant, you really want to be sure not to have mercury or PCBs or some of the things that can be in the fish. So one company that I like is called Nordic Naturals. That's a good company. It's a good quality product, and they test well. But there are a number of other ones that are out there.
They usually have third-party testing.
Yes, they have third-party testing. There's a group also that does a lot of kind of testing like that. They're called the Environmental Working Group. They're a nonprofit, and that's actually a great resource for during pregnancy also, because they even have lists of fruits and vegetables and what are the ones with the most pesticides versus the least. So if you're picking and choosing what you need to get organic versus not because you're concerned about the baby, it'll let you know what you really should get organic, because those are ones with the most pesticides in them. So that's actually a great website for people to check out. It talks about things like the mercury in the fish and the supplements, you know, but also other things like that.
And just to wrap it up, how, you know, what's your ideal patient who's carrying a child? What would be your advice to take care of a patient who's pregnant from beginning to giving birth and even some post care?
Mm-hmm.
What do you like?
Well, actually, I like to start before birth, because the conception also can be compromised if things aren't in, you know, properly structurally for the woman either. So then once a woman becomes pregnant, we'll often see her, if she's someone who already has been a patient consistently, we'll see her a little bit less frequently in the beginning. We'll check in on her every few weeks, see how she's doing. Once it gets closer to the actual birth, we like to check her once a week to make sure things are in a good alignment and she's ready, because, you know, the baby may come a little bit early, it may come a little bit late. We're not sure exactly when, but we want to make sure that she was in relatively recently. If there is something particular that comes up, the woman whose baby hasn't turned, the baby's breech, then we'll usually see him 2 or 3 times a week until we know that that baby has turned. So it depends on someone's situation a bit. But in general, you know, the ideal situation is they go through a healthy pregnancy. We see them occasionally in the beginning and then about once a week in the end. So.
Sounds like this is really one of your favorite parts of your practice.
It is.
Pregnancy and after births.
Yeah, it is. Well, it's such an exciting time in someone's life, and to be able to contribute to that and make that easier and healthier for someone in a way that is natural and non-invasive, it's incredibly rewarding.
Yeah,
to work with them.
I like how the doctors work as a team. You know, the midwives, the chiropractors, and obstetricians.
Yes.
Working together for the benefit of.
Yeah,
the
we're
patient.
actually in a very fortunate community here, where we do have a lot of people that are working together to really have women come through a healthy pregnancy and healthy birth, and really get those babies started out the way that they should in their lives.
Thank you so much for coming on the show and sharing chiropractic care with pregnancy with us. We've had you on before, and we really appreciate your knowledge base and your willingness to share
well,
with
thank
the
you for having me.
community.
I love being able to talk about this stuff. It's very important for people to be able to know what options are out there for them.
For more information on Dr. Eames, visit MarionChiropractic.com, or you can find her at Marion Family Chiropractic on Facebook. You can also contact her at 508-748-6632. Thank you for joining us today. I'm your host, Jackie Bell. We'll see you next time on Living Healthy.